because I have Medi-Cal. They look at me and they say, your insurance doesn't pay enough for me to see you. And they laugh at me. I have epilepsy. They took my kid away because my 45-year-old sister says I embarrass her. She doesn't know what epilepsy is. I was attacked by my coworkers at Bonds. They dropped a bale on my head and left me to die. I was working for the DEA at the time. When I came to the office, he says, I don't know what's wrong with you, but you better go see a doctor. I have to let you go. I worked in the inmates at Bonds. I am 48, a grandmother, and I've been a mother for 29 years. They put my daughter in a home with a crackhead last year because the Department of Children and Family Services pays them a lot of money to take care of people with these kids. My sister spanked my kid. Everybody spanked my kid. I just embarrassed my kid. But I've been denied rights. I've been denied a doctor, and I still don't have a doctor because I have Medi-Cal.
Thank you very much.
I'm honored to be able to address this question to you, Maxine Waters. Could you please explain single payer?
Yes!
And
Big clap!
will you be voting for it in September?
Let's talk about single payer for a minute. As you know, many of us prefer single payer, and that's simply like Medicare. Under single payer, the government would be responsible for paying out the cost of health care for everybody. It would come through the government. Now, let me just say this. We gave up on single payer because not only did we have pushback from the leadership, they were frightened, they didn't think we would get very far, and for those of us who wanted single payer, we said, okay, as long as we can get a government option for competition, we'll back off of single payer. Single payer does not have a ghost of a chance. We know that, not even in the Democratic caucus. And so rather than keep the divisions going and get all divided up inside the Democratic caucus fighting for something that we just couldn't get the votes for, we decided that we would place ourselves in concrete on public option. Now, one of the things that has riled up the progressive community so much is there have been some mixed messages about public option. And so the Progressive Caucus, the Black Caucus, the Asian Caucus, all of us have literally drawn a line in the sand. And we have said, we gave up on single payer, but we're not going to move on public option. And so, one of the things we're starting to pay attention to is this. Some of those who appear to be opposed to public option because they're doing the bidding of the insurance companies represent rural areas that have no health care. So we're going to have to send some people to the rural areas to tell the folks what their elected officials are doing. Thank you very much.
Okay, my name is Patricia Don. I'm a mental health professional working for the school system, but that's not why I'm here. I'm here because healthcare reform is long past due. I'm the 6th generation of my folks here in this country. My parents raised 7 kids without health insurance. My father worked all of his life. He never had health insurance for us. We depended on those community health agencies that were in the community. I'm the first generation that had an option of private health care. That's a shame. We should always have health care available for people. I have 2 brothers that died as a lack of working for small companies, and they could not afford to purchase health care insurance. No more of that. This is the year all that changes.
My question is, the House will almost certainly pass a bill with public option. There is a distinct possibility the Senate won't. Where is your line? Where is the line in the sand? Does your pledge hold even to a conference bill? All these other things are fantastically important. Obviously, without the public option, they are at risk. But what if something passes through But what if the conference bill doesn't include the public option? Is your line in the sand say, I vote no?
Absolutely. Let me tell you why. Be up to the fight. And the president has got to be up to the fight. And we're not going to have any, it's all right today, maybe not tomorrow, maybe I'm looking for something else. We want a public option. And not only are we going to do everything that we can to organize and bring pressure on those senators, some of whom are Neanderthals, we're going to say to the president, we want you to use every weapon in your basket in order to get those senators to do what they should be doing. I've been on the Ed Show, Good Morning Joe, whatever that show, and I said, everyone, I will not vote for a bill that does not have public option.
When I was in college, I did a protest against the first Iraq War, and there must have been 100,000, 200,000 people went into San Francisco. I went to look on the evening news, it was not on. I have someone who worked for a company called Blackstone who told me that the CIA has taken over Facebook, CNN, ousted Ted Turner. The CIA is bragging about controlling the media. If democracy can't work without good quality of information, and these people are inciting violence, they are fear-mongering, they're doing propaganda organized straight from Hitler's playbook, and we don't have, the media is controlled, they're defaming people, they're inciting violence. I mean, we need to get control of our media. All these things would be done already if we had the media under control. Healthcare is too important for profit, so is the media.
Thank you. You've got a lot of good ideas, okay? And I think maybe some of the hardest things to grasp on this is not an easy idea, okay? And it's not an easy idea, such as Medicare, okay? That was an easy concept. Even welfare is an easy concept. You're helping people that need to be lifted off, the bottom, right? And I think that, your debate's been good and the ideas here are good, but the question is, how do you simplify this message? Because that's why it's not getting through. And until it gets simple, I don't think you're going to win today. So you've got a lot more work to do to make it simple.
Well, you're absolutely correct, and we took 1,011 pages and broke it down this way. And we pulled out what we thought were the significant parts of that bill, which will probably be those areas that will be thrown into the conference committee that we'll be fighting for. Let me just say this. Every day we're working at trying to refine the message, trying to make it one that people will understand. One thing we've learned is public option now is well known. People get that, and they understand it in terms of one word, competition. And we're going to keep working at it, because you're absolutely correct. The way the media feeds information through sound bites, it takes a while. That's why these town hall meetings are very, very important. And the way that we have your response here today is so important, because you're allowing us to at least tell you what's in the bill. And a lot of the town hall meetings, they don't even get a chance to do that. So thank you. We're continuing to try and refine the message.